name's Racquel Beckett.
Hill.
Hi, my name's Racquel Beckett. I'm going to do my IV video test out today. So first thing I'm going to do is I'm going to wash my hands, and at this time I'd like to say that I already completed my first safety check here and read over the report, checked her PRN medications here, and so I saw what I needed to do, and at this time I want to say I already completed my first safety check. So what I did is I checked that I had the right patient, medication, dose, route, time, and documentation afterwards here. So that first safety check is completed, and now I just like to do my second safety check. So I'm going to just wash my hands here. So then I'm going to compare 50 milliliters, 0.9 sodium chloride, continuous IV, 0.9 sodium chloride, 500 mil. So, and then right patient, no allergies. And then this expiration date here. So, and that's not expired. And then here we have gentamicin, 60 milligrams, 50 milliliters, 0.9 NaCl, IV piggyback, time is now, no allergies, and right patient, and September 19th, everything matches there good, and this is not expired either, so not till 25, so that looks good. And then next we are just going to do our saline, so we're just checking here the expiration date, which is expired. So just for the purposes of this video, we're going to say none of it's expired, but if it was, I wouldn't give it to my patient. But and then we have next our Labatidel 20 milligrams once PRN IV push, Labatidel 5 milligrams 1 milliliter, 0.9 1825, so that's good to go. And we have a right patient, no allergies, correct date of birth. So now at this time I have done a second safety check comparing everything to the MAR. So I'm just going to wash my hands here, and then I want to do my labeling. So I wash my hands, the date 3/29/19, 3/29/19 by me, and then I just figured do this now, so it's done. And then we have a 5 and a 3, just so I don't get those confused. And then we're going to do our Labatidol here. And then 2, I already checked the pre-assessment. Her blood pressure is high, so she's going to need this medication here. And then so I have the medication name, the concentration, and then she's 20 milligrams. So and then we're going to put the date, 3/29/19, the time, and then my initials here, and then 20 milligrams total. There we go. And so that's ready to be used. And then the last thing I just want to label, so washing my hands before I do this here, is this one here. So I'm just going to put the date, 3/29/19, my initials, which is RB, and then the time, 8 a.m. And then also we want to put the length of the needle, which is 25 by 22 milliliters, the gauge and length of the needle, and that's all for that. And then I can just check and make sure that's correct when I'm at the bedside as well. So now I'm going to wash my hands and draw up my medications here. Like I said, I identified her PRNs. I read the order from the previous nurse, and so we have the sodium chloride, gentamicin. So then now we need 1/3 saline flush, and then 1/5. So first we can do our 5 here. So I'm going to open this here, keeping it sterile, and then I'm going to also open my filter needle. So breaking this cap here, open, and then keeping sterile technique here, I'm going to pull this straight out, put this straight onto here, and then I can toss that in the garbage. And this is sterile and clean, and so at this time I'm going to drop my 5 mils. I'm going to clean this off for 20 seconds here. 1, 2, 3, 5, 6, 8, 10, 13, 14, 15, 16, 17, 18, 19, 20. You want to get it super clean around the edges there. And so now I'm just going to take this cap straight off here, and then I can set it aside. And I'm getting 5 mils of saline here. So I'm going to pull back to 5, inject my air in, not touching the fluid. Then we can tip that up, and we'll pull back to 5. Making sure the fluid is in there, and then alright, that's directly at 5. There's got all the bubbles too. And then pull that straight out, and then we're going to recap it with this hard surface here. Okay, and see if we make sure we're good there. And right away, I'm just going to put on my 5 sticker, not on anything important there. And so now I'm going to clean again, and now I just need my 3. So, but I'm going to clean for 20 seconds here. 3, 6, 7, 8, 9, 10, 12, 18, 19, 20. Make sure it's super clean there. And then we'll open this up here. We'll keep sterile technique. There we go. Pull that, and then pull this cap straight off, and we'll keep that there. We need 3. Pull it back to 3 there. And then hold this, inject straight in, push in our air, not touching the liquid there, and then pulling back to 3. So got some bubbles there that we're going to get out. Alright, that's at 3 there. And I'm going to pull it straight out, and then I'm going to use this hard surface here and put the cap back on. Making sure there's still no bubbles. That looks good. And then I'm going to put my saline sticker directly onto it. Alright, and now we want to clean off our Labetalol package for 20 seconds here, the vial. So 1, 2, 3, 5, 6, 7, 8, 9, 10, 11, 19, and 20. So there's 20 seconds there. And then again, this is sterile. We're going to draw it up using our filter needle here. And then pull that straight off there. And then straight off, and keeping it sterile there. And for this one, we need 4 milliliters. I checked, and we need to give this medication to her. So 4 milliliters and 5 milligrams per 1 mil. And so here we go. I'm going to pull this cap straight off there, set it down, and then I'm going to insert it. I already cleaned it with alcohol for 20 seconds. I'm going to insert it directly into the middle, push my air in, tip back here, and then so this is my Labetalol. We need 4 milliliters here. Alright. Just want to make sure that I get all the bubbles out. Alright, so now I'm going to pull this straight out. We have our 4 milliliters. And then I'm going to put the cap back on using this hard surface here. Okay, so now I'm going to take my gloves off here, and I'm going to wash my hands and put the label directly onto it, just so I'm aware of what it is. Okay, and now I'm going to complete my second safety check. Even though I already checked, I'd rather just check again to make sure. So we have 500 milliliters of 0.9 sodium chloride continuous IV, time 8 a.m., Elsa Sutter, right patient, and then the allergies is good, so it's expiration date, good there. And then we have gentamicin, 60 milliliters, 50 milliliters, 0.9 NaCl, Q8 IV piggyback now, gentamicin, 60 milliliters, 50 milliliters. This is not expired, so we're good on that. And then next I'd like to do my labetalol here, so comparing my syringe here. Labetalol 20 milligrams once PRN. I check the MAR for that. Time is correct, and then no allergy. And then for the right patient, comparing it here, right medication and not expired, so we're good there. And then we can also check our saline flush, which I already said this is expired, but just for the purpose of this medication video, we're gonna use it, and matching here, so we're good to go on that. And so I just want to say for my first and second safety check, I completed by checking all the expiration date, her allergies. She's not allergic to anything I'll be giving her. She has an allergy to penicillin. So I checked that we had the right patient, medication, dose, route, time, and documentation afterwards. So now I'm going to keep my meds in my site at all times, and I also checked that they are compatible, so we're good to go on that. And I'm just going to bring my stuff into my room here, watching my meds. So keep this here. Alright, so I'm going to set this down, and I'll just pretend that I'm outside the room right now. The first thing I'm going to do is I'm going to knock, then I'm going to wash my hands, introduce myself. Hi, I'm Racquel Beckett. I'm going to be your nurse today. And then provide privacy by pulling the curtain or shutting the door. I'm going to give you an IV today that the doctor has ordered you for some medications that I'll explain in a minute here. So then you look like you're in a safe position. You have your call light. So now I just want to compare that I have the right patient to my MAR. So, yep, Elsa Sutter, date of birth 3/1/1940, 3/1/1940, and then allergies, penicillin. Do you have any other allergies I should know about? Nope. Okay, sounds good. So we're ready to go. We compared that there. And so now I just want to do my third safety check. So I'm going to wash my hands here, and I'm going to compare all of my medications to my MAR one more time before giving it to the patient. So we have 500 milliliters of 0.9 sodium chloride, continuous IV. It's the right time, 0.9 sodium chloride, 500 milliliters, correct patient, Elsa Sutter, and then no allergies. And then expiration date is checked there. Not expired. And then we have gentamicin, 60 milligrams, 50 milliliters, 0.9 NaCl, IV piggyback, gentamicin, 60 milligrams, 50 milliliters, not expired, times now, no allergies, correct patient. And then we have our labetalol here, right here, labetalol, comparing it to here, and my syringe, 20 milligrams once PRN IV push now, no allergies, correct patient, not expired. It matches up here and with my label here, so that's good to go. And then we just want to check off lastly our saline flushes. We have a 3 and a 5. Checking here, yep, saline. Like I said, if something's this is expired, so normally I would never give it to my patient, but for the purpose of this video, we will be doing that. And so now I'm just going to wash my hands, keep my eyes on all my medications the entire time. And so I'm just going to bring a few things over here to my patient. So I washed my hands here. I'm going to wash my hands again. I'm going to put my gloves on here. And then actually I'm going to tell my patient a little bit about their medication. So we have gentamicin here for your UTI. Side effects may be fever, rash, phlebitis, diarrhea, neuro disturbances such as being dizzy. We want you to stay hydrated, so make sure you continue drinking water. We'll monitor your in and output, and make sure you're drinking enough. We'll help you with that. And then I want to let you know too, we checked that everything is compatible, so you don't have to worry about that. And then we have your sodium chloride here. It is uses for hydration, facial flushing, fever, irritation, edema could be possible side effects, but only if you push it too fast, which we won't today, so you're good on that. And then we'll just be monitoring your in and output, blood pressure, daily weight, and lungs, which I already checked for good today, so that's fine. And then lastly, we have your labetalol. It's for your hypertension. Side effects could be dizzy, drowsy, fatigue, blood pressure changes. We want you to go from slowly from lying to standing. I assessed your blood pressure and your apical pulse before administering it. And I can see here on the report from the last nurse, it's 163/92. So it's above 60 and 90, so we're going to be giving that today, and I'll continue to monitoring your pulse and blood pressure there, so that's good to go. Just set this there, and then now I'm going to wash my hands, and then I'm just going to assess your arm, and I'm watching my medications the entire time of doing this. Everything's compatible. So I'm just going to stick this under your arm here, and this is your non-dominant hand, and I'm going to assess the area where I'm going to feel alright, so 4 to 6 inches up, and then I'm going to not leave that on for more than 2 minutes. I'm going to assess. Right here looks really good. Non-dominant hand, no tenderness, redness, swelling. Your radial pulse is still good, so blood flow is good on that. And then now I'm going to take my gloves off, wash my hands, and then I'm going to put some new gloves on. I already gave you education on it. I'm going to clean a site where I'm going to inject my patient with new gloves. And then I'm going to do this for 20 seconds. So right here where I had picked 2, 4, 10, 13, 16, 17, 18, 19, 20, so that looks good. It's really clean, and we'll allow that to dry for about 2 minutes. And so I'm going to take my gloves off. I'm going to wash my hands. Just bring anything at this time over that I may need over here. And then I need this set here. Okay. Just opened that up there. And then if we need any of these alcohol wipes, we are going to bring this over. And so I'm just going to wash my hands here, and then I'm going to put my gloves on real quick. Okay, and then I'm going to prime my extension set here. It's sterile. Okay, and then let's see, we need the 5 saline flush, and so this is sterile. I already primed it there, and so we're gonna just take this cap directly off with a needle, put it directly into the sharps, and so looks like her arm is about dry. I'm gonna connect it here, being very careful to keep sterile technique. Okay, and then here I'm gonna prime the extension tubing. There we go, and then making sure this is completely sterile here, which it is. I also want to just loosen this cap a little bit because sometimes it can be like a little tricky, so I'm just going to make sure that this is loose. Keeping all this sterile. Okay. And this would stay in there. This has stayed sterile, so I can still use it, but if I'm unsure here, all I have to do is throw it away, clean with an alcohol wipe, and put a blue cap on it, but I didn't touch it or anything, so it should be just fine. I just pulled it straight off, and so I just wanted to keep it loose. And now I'm going to set that back in there. It's still clean there, and so we're good to go on that. So now I'm going to wash my hands here and get ready to inject into my patient. I'm still watching my meds, as I said. So here we have the needle we're going to use. And so it's clean, it has already dried there, so we're using 25 or 22 gauge 25, and then I'm going to put this around my patient 4 to 6 inches up here. Make sure feel still radial pulse, we're still good on that. And then so I'm going to warm my patient. You might feel a little poke here. Pull it directly out, making sure not to touch the hub or anything. Holding down on the arm here, and so we're going to go in at about 4 to 6, with the bevel up at a 10 to 30 degree angle here, and so looks like we got flashback there, and so I'm going to insert about another 1/4 of an inch there, and then I'm going to advance the catheter here, being very careful not to touch the hub. I'm occluding here, putting that directly into the sharps, pulling this, and now we can connect our sterile connection here. Pulling it straight off, still occluding, being very careful there not to touch. Okay. Then I didn't touch the hub at all, and so now all I'm going to do is grab this out of here while stabilizing, and then putting it over the arm. It's kind of scary. There. Okay. Then there we go. I'll take this off, make sure my patient is still doing well. So and then I'm going to put this on right away. My label 22 gauge 25, so that looks good. We pulled that off, and so now I'm just going to take my tape here. We pulled the tourniquet off right away, as you can see this other
Just
side.
to make sure, yeah.
Yeah, just clarifying, but I did pull it off right away, so it's fine, and I think I verbalized that. So now we can push the rest of our medication in at this time at a slow rate, and then now I'm going to, use my other medication. So we're going to be using our labetalol, and so I didn't touch this, it's still sterile, but just to be sure, I'm going to take it off here, and I'm going to clean for 20 seconds. 3, 4, 5, 6, 7, 10, 11, 12, 14, 15, 16, 18, 19, and 20. So I'm going to take this cap off with my medication, keeping a sterile connection here. and I had labeled it, and so I would push this in at a rate of 10 milligrams per minute, so 4 milliliters over 2 minutes, but for the purposes of this video we won't do that. So now I'm going to take this off now, make sure my patient's still doing okay, assess the site, and let go of that since we're going to clean it anyhow, and then we'll clean this again for 20 seconds, and then we'll push our last saline flush in, 2, 3, and 20. And so now we are going to take this cap straight off and put it directly into these sharps, and this is sterile here, making sure not to touch, and then we're going to push this in at the same rate as our medication here, so same time, but for the purpose of this video we won't do that. And so now she got all of those, and so now I'm just going to take my gloves off here quick, and then I'm going to just keep my medications and everything in sight. Washed my hands just there. I can do it again, so I don't know if the camera saw that. But, and then I'm just going to do the date, the time, and then at this time I can say that I inserted her the date and the time, so 3/29/19, and then the time is 8 a.m. And I also want to say I did the IV attempts was 1, and then in her right, or yeah, it'd be her left lower forearm here, and then date, time, and then we'll do my initials there. Alright, so that's good for that one. And then I'm going to finish on here, 8 a.m., and then it was the left lower forearm is where we gave that one. So date, time, location, and then we have my initials there. And so now I'm going to wash my hands here, make sure, yep, my patient is still doing good. And so I'm going to get ready to prime my A-line. So wash my hands, got all that done. And so I want to make sure that all of my tubing is locked, so I'm going to pull it out here. And yep, I see that it is locked there. Just untangle it here. Okay, so then now my tubing looks like it is good to go here. And so the first thing I want to do, because I don't want to lose any medication, is I wash my hands, put my gloves on, and then this is a sterile connection, so I want to take this straight off along with this, and I want to put it straight in. I'm going to use my other hand here. Okay, so that's good to go there. So now I can tip it up. And then now I can hang my bag for my patient. And then I completed all of my safety checks. So the first thing I want to do is I want to fill the drip chamber 1/2 to 1/3 full. And then now I'm going to fill my Minnesota here. Let me untangle all of this. I thought I got it, but it's still a little tangled here. There we go. And so now I'm going to do this, and then I'm going to fill my Minnesota. It's full. Now I'll tip it over and then let all the fluid go through. just to clarify, this is from my clamp there, and so I'm still watching, making sure I get rid of any bubbles at this time. So looks like there's still a few, and so you can just flick them out. And two, looks like there's a few that aren't coming out with gravity, anything else, but I can do my best to flick them out of there. But what I'm going to do is I'm going to let this run into my bucket here. This is a sterile connection, so you want to keep it clean. So I'm pulling this straight off, and I'm going to let it run into my bucket. I don't want to give my patient an air embolism, so I just want to make sure that all of my bubbles are out. It looks like my tubing is clear, no bubbles. And so what I'm going to do now, just in case I did touch something, I don't think I did, but just in case, I'm going to clean it here and put a new cap on for 20 seconds. And 20, and so now I have a clean cap in my hand, keeping that sterile. I'm going to open this up here. Keeping it sterile, and put the cap on that. Alright, and then now that that's clean, you can set that there. We can shut this here, and then now we are going to get our secondary bagging primed here. So we have this. First thing I want to do is make sure it's clamped. I have my two sterile ends here, so I'm going to take this cap straight off, put it there, and then along with this one straight off, here's the sterile connection again. That's really important because you don't want to lose any medication for the patient. Alright, that's completely on. We kept that sterile. And so now I'm going to come here, and again, like I said, this is clamped, and so now this is also clamped here. So we're good to go, and I'm going to take this directly off. This is a sterile connection here, so I'm going to take that straight off there, set it there, and then also this one, sterile. You don't want to touch these two ends, and put it straight in, maintaining sterility there. So now I'm just going to take my gloves off, and I'm going to wash my hands here, and then I'm going to get my pump on and compare here. So then now that these lines are open, clear all these settings, yes. And so we're gonna do our back priming here. Oop. We're back priming. We'll get that drip chamber there to that line. I still don't see any. Alright, so now we are going to prime our A line, right here, and so we'll do our A line will be sodium chloride, so it will be at a rate of 125. 125, and then for 490. Yep, that's correct. And so we can just clamp all of these just in case, because we're going to hit start and then stop, and then we're going to prime our beeline. And then we're going to do our beeline, checking here against my MAR. Just wanted to say that. We're going to do my beeline here at 50. For 50, and then be over 1 hour, which is correct. And so now I'm going to walk over here. Now I compared that to my MAR, so I know my rates are correct. I'm going to wash my hands, keeping an eye. My patient said she's still doing just fine here, so she doesn't notice any side effects we have discussed at all. And I also let her know everything's compatible, and I'm watching all my medications. And so now at this time, I'm going to alcohol wipe this off. And so I'm gonna, these are 2 sterile ends, so I'm gonna take this and I'm gonna clean for 20 seconds. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 19 and 20. All right, and then this is sterile, and I just cleaned it, so it's clean and good to go. First, I want to make sure, yep, everything is clamped here, so that's all fine. I'm gonna take this off. Okay, and then connect it to my patient, keeping a sterile connection here. So that's on there, and then now at this time, I also want to say this is clamped, so we would unclamp it. We just didn't want backflow, and so if I didn't do that before, I would have said that, and so we just didn't want backflow, but now at this time, we can unclamp it, and then I can take my gloves off, I can wash my hands here, and then now I can unclamp these. Then we can press start here, and then we'll hit our A line, and then we want to press start. And so see, our A line is delayed and our B line's pumping, and so just for the purpose of this video, we want to just stop it and stop all. And so now I'm checking on my patient. My patient's doing great, doesn't need anything, so now I'm going to wash my hands here, and I'm going to finish my documentation. Turn this so I can keep my patient in mind. There are call lights there. She's in a safe position. She's not having any tenderness, anything. And so now I'm just going to do the date, 3/29/19, 8 a.m. And then where we gave it, left forearm there. And then the concentration, the rate we ran it at is what we want. And then we want my initials, and then the concentration, and then rate we ran it at, and then I'm gonna do my initials here, and then just make sure I have everything. So yep, I have the date for all of them, the time, left forearm where I gave it, the rate, and my initials for all of them. And then we also already documented my IV, 1 attempt, left lower forearm, and then the needle gauge we used, which is here, is a 22 gauge and 25 millimeter. And so now at this time, I'm going to just make sure you're doing well. Let me know if you need anything else, or if you have any side effects we talked about. And then I'm gonna stick these around here, just so other people can know that I did change them. And my patient looks comfortable, and that's the end of my IV test out. Thank you.